Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes once again for you all. Our contact number is 76967342256, and this is a writing video which is very important, and this is the writing video which is going to be a pathway to clear your OET writing, because since last October the maximum time this kind of letter has been repeated. It's a very tough letter and it will bring some distraction, so please try to focus. I know it's going to be little lengthy video, but I promise you I will try to make it as interesting as possible. Subscribe our channel if you have not, for the best and the latest videos and the latest information about OET coaching. So I'm just going to start this session, and trust me, it's going to be very important. It's going to be little lengthy, so please don't get carried away. And also I will talk in English in the whole session so that you all can understand it, but at the end I will talk in Hindi as well to tell you what this letter is all about. So please try to listen to this video completely. Even while talking in English, I will make sure that I'm talking slowly, but slowly means obviously that's going to be little boring, but I will try to make it interesting again. And now let's go to the writing itself. So this is Dr. Bhupesh once again for you, taking you to the writing session of the day. So this is the writing that I want to discuss. This is basically taken from OET original site. And as I have told you, we do not create question papers. We take question papers, and especially from the original site of OET. So it's pleasure. Thank you for preparing this question paper. And I am here to help you with the best sample paper that can be created, and in the easiest possible way. And to make it all easy, it's always a challenging task to let you know how to start in the paper, how to go about it. So please follow this approach and you will never have any problem regarding the writing. So I'm just taking it on. Yeah, done. So this is the writing task. So you can well imagine, so if you have an exam, suppose you have an exam, and you get letter of this kind, such a big letter, and you would be like, oh my god, like I have to write only 180 to 200 words, and this letter, if I write everything, would be around 400 words. So obviously it's going to take all the peace away, so you have to maintain your calmness. Again, I'm going to make this letter very simple for you. So always start your letter from the end, because end of the letter says to whom you are writing the letter. So when I read it from here, you are the community nurse and you are writing to Suzanne Matthews GP. Who is Suzanne Matthews? That must be your patient. So I go to first page to check it. Who is Suzanne Matthews? Patient name. So Suzanne Matthews is the patient name, and I am writing the letter to Suzanne Matthews GP. So most probably this kind of letter is a referred back letter. Why? Because most of the cases when there is a serious problem in the foreign countries, patient goes to GP. GP refers the patient to specialist. Specialist provides the treatment in the hospital, and then specialist sends the patient back to GP. Again repeating. So what happens in the foreign hospitals? That patient, I'm just going to take this marker. Patient goes to GP, then GP refers the patient to a hospital. Then patient gets treated in the hospital by a specialist. Then the patient is better, and the follow-up care again is provided by the GP. So here is my GP. So it's a complete circle of a referred back letter. That patient, when he has some problem, suppose he is having chest pain, he goes to a GP, and GP suspects that it can be heart attack. So he immediately refers the patient to a hospital where cardiologist is there. So when the patient reaches to a cardiologist, he takes the treatment. After 2-3 days, when the patient gets the discharge, then patient is sent back to GP for the follow-up care. So cardiologist do not provide the follow-up care, or hospitals do not provide the follow-up care, because they are already busy. That is why GP, patient GP, is the person who provides the follow-up care. So if you can understand, GP is referring the patient to hospital, hospital is referring back to the GP. That is why they are known as referred back letters. These are the most commonly repeated letters when it comes to OET exam. Let's see whether this letter is a referred back letter or not. But in my perspective, this letter should be at least 90% it should be a referred back letter. But again, this is a tricky letter, I'm telling you. Need to keep your focus high. This one letter, again, it's going to be a little lengthy, but you will not face any problem in OET writing in future if you understand this letter. I will try to, summarize all the concepts, including the grammar, the connectors, the message, everything to you. It would be a good lecture. Please watch it till the end and subscribe our channel if you have not. And I'm just taking it the next level. Okay, so now I understand that I have to write the letter to Suzanne Matthews GP. So when patient is already a patient of GP, that means GP knows about social history and medical history of the patient. So in this kind of a letter, I am 100% sure that social history and medical history should not be written. So that provides calmness to my mind, that I would be able to save. I would be able to save the word count, which is only 180 to 200 words. In OET, we are allowed to write maximum of 200 words. So when I get to know it's like the patient's GP, social history and medical history is not supposed to be written. So that saves my word count. Now taking to next thing. The most important date. The second thing when you will do when you understand to whom you are writing the letter. So first thing is to whom you are writing the letter. So I got to know I'm writing to Suzanne Matthews GP. Now the second information I need is about the current condition of the patient. So current condition always comes in the end. The last date is always the current condition of the patient. So I'm just taking this on. So this is the current condition. Let me check out the today's date. So this is the last date. So that is today's date, 20th of November 2016. Patient is coping well. Patient is very positive, mobilizing independently. So that means there was some problem with the mobilization earlier. That is why they would have written patient is coping well, patient is more positive. So that means there can be some mental issues to the patient as well. That is why they are talking about that patient is now more positive. So that means there were some kind of issues, that patient was negative, and now patient is mobilizing independently. That means there would have been something that patient was not mobilizing independently. Then patient wound, there is no sign of infection. Wound means obviously there would have been some kind of an injury. So he is eating well, needs to be monitored. He is now eating well, but that means there was some problem with the eating as well. So these letters make it very easy. Now GP knows. Now when we are writing to Suzanne Matthews GP, so GP will understand that patient was having eating issues, patient was having mental issues, patient was not mobilizing independently, patient was having some wound. So now we will see, and sutures to be removed in a week. So the wound was that deep that sutures were required. So now I understand that I am looking out for a patient, Suzanne Matthews, who had an injury, who is having some mental issues, who is not eating well, who is not mobilizing independently. So she is having multiple problems. But I'm writing the letter to patient's GP. So GP might be already knowing about these things, that patient normally is also not a good eater. Patient in the past also showed that he's not eating, she's not eating well, she must be having some mental issues. So let's see what is this letter. So but this gives me lot of satisfaction that my letter is easy, that now patient has recovered, patient is more positive. So GP just needs to provide follow-up care. So the GP, this is the most important message, follow-up care. So GP now just needs to provide the follow-up care, because Suzanne Matthew is already a patient of GP. So GP now needs to provide follow-up care, because now patient is positive, mobilizing independently, wound is better, there is no sign of infection, she is eating well. Sutures to be removed in a week, that GP can do after a week. And then you are concerned about patient mental health, weight and wound. So there are three important things. So this task is also the most important thing. So this is giving the message. So these are the three things that are very important in the patient now. Mental health, that I told, more positive. So GP needs to monitor the mental health. GP needs to monitor the weight, because now she is eating well, but it needs to be monitored. Her wound, now there is no sign of infection. So three things again. So these two things are the common message, if you can see. So now I will clear it all. So this is my purpose. So my purpose, the most important paragraph is already done. That purpose is to monitor the wound, monitor the mental health, monitor the weight. That's it. That is the purpose. Suppose if I forget the whole letter, generally saying, if I forget the whole letter and that this letter is too big, if just I have to write the purpose, I need to know what happened to Suzanne Matthews. So I'm just taking back to the first page. Let's see, let's read about the patient, what is happening with Suzanne Matthews. Now we would read the complete history. In exam, you will get 5 minutes in which you will not be allowed to pick up your pencil, and the next 40 minutes will be to write, and writing 200 words take only 15 minutes. So that means the most of the time is to think which data is important, which data is not important. So in OET, grammar and data selection are the two most important things. Grammar and data selection, and the most important thing above grammar and above data selection is the purpose. Purpose we have found in this letter, that this letter is being written regarding your known patient Mrs. Matthews, who needs follow-up care. Therefore, she is being referred to you for the required care. Purpose is over. This letter is being written regarding Mrs. Matthews, regarding your known patient. I need to take marks patient GP. So this letter is being written regarding your known patient, comma, Mrs. Matthews, comma, who needs follow-up care and monitoring regarding her mental health, wound, and weight. Therefore, she is being referred to you, or otherwise, therefore, you are requested to provide her the required care. That's it. That is the purpose. That she needs follow-up care and monitoring regarding mental health, weight, and that wound. That's it. So the purpose is all done. So you can make your OET such easy that even this line is enough. Let me write it for you. Let me make it easy for you. Yeah. Otherwise, maybe you will miss out. So I will write it and will try to make it the easiest for you as said earlier. I'm just gonna take it along. Sorry for these combusting thing. Later, why pages are not available? Yeah, pages are available. I'm just gonna take this thing. So if I have to write first paragraph, and also I will in the last I will show you the pattern how to write the date and everything as well. But first I want to talk about the purpose, which is the most important thing. So purpose. This letter is being written, and now see, writing will not take time. I will just write it in seconds. This letter is being written regarding your known patient, Mrs. Matthews. Spelling mistakes you can cover up. Maybe for the Matthews, if double T is given or single T is given. Mrs. Matthews, who needs follow-up care. These are the two words that was given in the writing. Follow-up care. Who needs follow-up care and monitoring regarding her mental health, wound, and weight. Being her GP, you are requested to provide the required care. That's it. My purpose is all done, and I am now almost 90% sure that I will pass because I have written the purpose. This letter is being written regarding your non-patient, Mrs. Matthews, who needs follow-up care and monitoring regarding her mental health and wound and weight. Being her GP, you are requested to provide her the required care. That's it. Now, if I can do better with this letter, what things I can do better? Let's see what I can do with the purpose. What else can I do better? So Suzanne Matthews, 76-year-old, husband died 5 years ago. So GP already knows about it. I don't want to waste my words. GP already knows about it. Lives alone in home, involved bowling, CVA 4 years ago, lonely and isolated since husband passed away. This can be utilized that we can say, as you know, that she normally feels lonely and isolated since her husband passed away. If I require this line, if I do not require this line, I will not write it. But generally saying that I will say, please take care of her mental health. As you know, she normally feels lonely and isolated since her husband passed away. We can write this. But if I do not need it, I won't write it. It is upon my choice. If I can fit in this data that that normally she feels lonely and isolated as her husband passed away, as you already know about it. So if I need this line, I will write it. Otherwise, no. Patient weight is 48 kg only. Age is 76. Age is 76. Weight is 48 kgs. Hip replacement 2014, hypertension diagnosed 14, non-smoker. So I can utilize any of the data or I may miss it altogether. It's my choice. My choice. Because I am the one who is writing the letter to the GP. So I will choose. I am the nurse. I am the doctor. I am taking exam today. So I have to justify what I am writing and why I am writing. So for now, I don't want to include this because my letter is huge one. And I also need to remember the date of today. So the date of today was again, let me check out the date again. Sorry. The date of today is 20th of November. The last date, 20th of November 2016. And let's see what's given in the first one. It's 10th of November. So it's 20th of November today. So 10 days ago, the incident happened. What happened? 10 days ago, patient was presented to emergency department. Accident happened. She fell off the ladder while cleaning the fan in her house. Neighbor brought her to the hospital. Now, this is not a referred back letter. I'm really sorry, but I wanted to teach you everything. So you need to understand now. This is not a referred back letter. Why? Because patient was presented directly to emergency department because she fell and she had an accident. So neighbor did not take her to the GP. Normally, I told you, first of all, GP would be there. GP would be sending the patient. That is why if I talk about this letter, if I talk about this thing, I don't have to change anything. If I would have, if GP would have referred the patient, then I would have said, this letter is being written regarding your referred patient, Mrs. Matthews. But now the patient has not been referred by GP, so the old thing is okay, that this is a known patient of yours. That is the best part. If GP would have referred the patient, I would have said regarding your referred patient. But now the patient has not been referred by GP and it is not a referred back letter. So my wordings are all good. So this letter is being written regarding your known patient, Mrs. Matthews, who needs follow-up care. All good, nothing to change. Coming back to the point. Just take it easy. Again, there is nothing heavy about it. It's just I'm taking time to explain you guys. Concentration, please maintain because this one letter will teach you everything. Now I don't have to write anything. On 10th November, patient presented to the emergency department brought by the neighbor. Accident happened. She fell off the ladder. Observation was she was having laceration to the right thigh, bruising, grazed legs, disoriented mentally. 10 sutures to the right thigh were applied. So when she was brought to the emergency department, 10 sutures will apply. 10 sutures were applied. Passive voice, was were third form, were applied by the hospital. So 10 sutures were applied or 10 sutures were done onto the right thigh, graze, antiseptic, clean, tetanus injection, you can say. X-rays, nothing broken. So there was no fracture. Admitted to the hospital for observation. So on 10th, that means today is 20th, almost 10 days ago, the patient was admitted to the emergency department due to accident and 10 sutures were applied due to the laceration on the right thigh. Done. Now, on the following day, 11th, patient was sore. Patient was sore. Sore means pain. Patient was having pain and disoriented. Not sure how accident happened. That means mental condition was not good. Anyhow, in the past, she was feeling lonely and isolated. She had CVA, cerebrovascular accident as well. So her mental condition is already feeble. And now she was disoriented that how the accident happened. She's old as well, 76-year-old. Not interested in food. So food, eating habits. This is important for me. So I would be choosing all my data according to what I need to do. So now I had to take care of the wound. So I have to talk about laceration. I have to talk about 10 sutures. The second thing was about mental condition. I have to talk about disoriented. Not sure how accident happened. Third thing was about weight. So I have to talk about not interested in food. Wound dressing and monitor patient health. This is important. So this is the only data I would be selecting. These are the words I will pick up, because in the last I was given wound, mental health, and weight. So wound, mental health, and weight, food, and again wound. So these are the only words I will pick to kind of make the letter concise. Concise means brief. So I will do it as small as possible. Okay, so this is the trick. It is not trick, it's simple that GP wants to know about mental health, food, and this. So you don't have to over explain things. So these are the only important words. That's it. Out of the first two visits. Third visits, let's see. Wound site red, swollen, pain, temperature, unwilling to shower. Temperature means infection. That is why oral penicillin was given, paracetamol was given, paracetamol, and this, and lack of appetite. Food again. So on second day of admission, 10th, 11th, 12th, she suffered from infection. Wound site was red, that was swollen, that was graze oozing out, temperature was 38-degree, unwilling to shower, and this. So we arranged the visit with the dietitian and physio. So the dietitian was called, physio was called. Wound was cleaned and dressed with non-stick dressing. So the wound was cleaned and non-stick dressing was applied. So we can understand the story. There was a patient who came to us with a laceration to the right thigh brought by the neighbors. So immediate treatment was given, sutures were applied, but second day she got some infection. Also, she was little disoriented and she was not interested in food. All those things were happening. Let's see. Next. I will make it very simple. I promise you. Just need your company to make sure that you understand. I promise you, I will make it very simple, and you will get to know why OET is the easiest or easiest thing, and why writing module is the easiest one. So just please focus, and Dekna, when we will write, it will not take even like 10 minutes. I promise you. Just your concentration, please. Dietitian review. So the third day, 10th, 11th, 12th, 13th, sorry, the fourth day. 13th, dietitian review, new high protein diet, aim to increase weight, because her weight was normally 48 kg only. Then she was not interested in food. So the dietitian was called to increase the weight. So high protein diet was given. Physio mobilizing, with the help of the physio, patient was mobilized and was helped to patient physio mobilizing the patient with transfers, shower, toileting, bed, etc. Temperature 37. That means after amoxicillin and the medication temperature penicillin, the temperature become normal the very next day. On 12th, it happened. 13th, it was gone. Treatment wound was cleaned. Paracetamol was given 4 hourly. On 14th, that is the fifth day, patient's condition improved, because we cannot write in the present, because today we are on 20th and this data is of 14th when the patient was in hospital. So on 14th, patient's condition got improved. Again, that is what you need to write in the final. Patient's condition got improved and she started following diet and enjoying food. Patient's condition got improved and she started following diet. So earlier she was not following diet. Now she has started following diet. Swelling reduced, nil exudate, nil fever, pain controlled, mobilizing independently but slow. 15th, that means on the 6th day, medication paracetamol as needed, oral penicillin for 7 days must complete, referred to community nurse. Now this is the mind-boggling this thing of this letter, that this data was of hospital and patient was referred to us. Who are we? Let me check out. Let me tell you again, who are we? Please understand. You are the community nurse. That means you have provided this treatment. So this was done in the hospital. This was not done by you. So when the patient was given to you, patient condition had already improved. Patient was following diet. Patient was enjoying food. Swelling got reduced. Medication were paracetamol, and then the patient was referred to you. So if I talk about during hospitalization, let me take you to that thing. Yeah. Now I'm just going to write it, the second paragraph, and we'll try to make it very simple. And we'll, again, you don't have to even see at the letter, because the more you will watch the words, the more complexity you will do with the letter. So to make it simple, leaving one line, and writing it from the extreme left. Don't write it from here, from the middle, like the British letters. No, write it from the start, from the left side, leaving one line. So the first paragraph is all good. This letter is being written regarding Mrs. Matthews. So Mrs. Matthews was brought to the brought word would have been written when I would have been in the hospital. Then I would say was brought to us. But now this is not a nice word. Mrs. Matthews was taken to emergency department. This is natural. Was taken to. So I'm telling the GP of Mrs. Matthews that Mrs. Matthews was taken to an emergency department on 10th of November. Please write it as natural. The natural you will write, the better you will become. On 10th November, I will make it very simple, I promise. Just keep your concentration high. On 2016, it's taken to due to falling and was found with laceration to the right thigh. For that, laceration. Laceration means for that, that due to laceration. For that, so you can use the connector for which as well. So if I put a full stop here, then I will make this. She was found with laceration. Now this line is a small line. Now I can use the connector for which. So even the connectors are according to what I use. So when I put commas, then I use for which. When I put full stop, then I use for that. When I use full stop, I use for that. When I use comma, I use for which. So now I have divided it in two lines. Mrs. Matthew was taken to an emergency department due to falling. She was found with laceration. So if I write there, there means in the emergency department. Now it makes it more smooth. That is, connectors are not only about for which, who. These are very nice words, natural words. That Mrs. Matthew was taken to an emergency department. There, she was found with laceration to the right thigh, for which 10 sutures were applied. During hospitalization, during the subsequent days, now I'm trying to mix up the whole information. During the subsequent days, she was disoriented and also got wound infection. So was oral penicillin along with paracetamol was commenced. So I'm telling the GP generally about the patient that PCM was commenced, PCM paracetamol. Further, just natural, she stopped taking food as well. So dietitian review was conducted who helped to increase her diet, who helped to increase her diet and added with more proteins. So I wrote it very simple. On 15th November, now the whole story is matching up. She was referred to us in condition more natural, in condition that is the most natural, in the condition in which she was enjoying food and There was no fever or infection. I think that was the thing that we studied. Let's see if it is matching. So wound was cleaned and dressed. So I don't have to explain everything. So condition was improving. Medication paracetamol, oral penicillin was continued. She was sent to us with no fever. Pain was controlled, mobilizing independently but slow. She was enjoying food and there was no fever infection. She was mobilizing independently with the help of, but independently but slow. So these are the things I wanted to write. So now you will understand how simple it is if you will write in your own. I hope you are all able to. I just want to make sure that you all are here. I hope you haven't all slept. So that is why I'm taking it back. So I hope you all are understanding. Can you please write in the chat box that everything is okay, guys? Just couple of messages on the chat box will make sure. Okay, Caroline says yes, someone says yes, Manpreet says yes, Redmi says yes, Manpreet sir says yes, Icon says yes, Jelina says yes. So I hope you are all enjoying the session as well. I know letter question paper can be tricky in OET, but trust me, answer paper should be as simple as possible. Never make your answer sheet complex. So I have written everything that Mrs. Matthews was taken to an emergency. So was not brought because she wasn't brought to me. I am a community nurse. So was taken to an emergency department due to falling. There she was found with laceration to the for which 10 sutures were applied during the subsequent days. Or I could have written during hospitalization. It's either of the words I can use, but I want to make it better. During the subsequent days, he was disoriented, got wound infection. Oral penicillin along with paracetamol was consumed. Further, she stopped taking as well, food as well. So dietitian review was conducted, who helped her to increase her diet with more proteins. On 15 November, she was referred to us in condition in which she was enjoying food and there was no fever, so wound was all good. Infection got subsided. That means I talked about the wound infection. Now it's gone because paracetamol and penicillin was given. Also, she started. I wanted to use also, but then you cannot write also all the times. That is why I avoided. She was mobilizing independently, or I can say she started mobilizing independently as well. But I did not use the word started because earlier I did not tell that whether she was walking or not. So again, this is all understanding. That's if I say she started mobilizing, that means earlier she was not mobilizing. But over here, I never mentioned about whether she was mobilizing or not. So I was saying when she came to me, she was mobilizing independently but slow. So now would be during our care. Let's see what happened with the community nurse. What happened in our care during our care. During our care, patient on the first day, patient was moodily, lonely, and not coping with the new diet. So she started enjoying food over there. But when she came to us or we went to her home, she was lonely. She was moody. Means in the hospital, she got better. But when she came back home, she again became moody. That is why this is the most tricky letter. She again became moody. She was not coping well with the diet regime. She was mobilizing well at home with frame. So with frame, regular paracetamol, wound was cleaned and dressed with antiseptic solution. Refer the patient to meals on wheels and domiciliary care. Domiciliary care always means home care. Domiciliary home care. So because she was not coping up with the diet regime, so first day we said you take meals on wheels. That means there would be meals on wheel means somebody will come to deliver the food. You don't have to cook. And refer to social worker for the local support groups because maybe her mental health because she was feeling moody and lonely. So we said that local support groups would be important. Then after 2 days, pain got controlled. No exudate, no redness. Patient started meals on wheels. That means she started eating that. Patient mood got improved because local support groups would have helped, and the limb and the wound was left exposed. Today we already know that she is well, she is positive, she is mobilizing independently wound. So now I will tell the GP about few more things. During our care, or during the first day of our care. Again, make it more simple. The more you write clearly, the better it is. During the first day of our care, she was found to be moody and lonely, so was referred to local support groups. She was not eating food following diet regime. She was not following diet regime, new diet regime, for which she was referred to Meals on Wheels. Simple was were third form. That is how simple grammar is. Commas, grammars. That is why I would encourage write this letter by copying it 5 times. You will never face any problem because then you will understand how to write easy, where to put commas. Write it 10 times and put the right commas, right connectors, and couple of connectors would be obviously sometimes when letter is complex, they are kind of used double the times. So you can avoid it like in this. I can say for that and for that. When I use the word and, then rather than which, and act as my connector, and then I say, and for that she was referred to Meals on Wheels. Now see what happened after this. And there was other wound was cleaned, Meals on Wheels, all good, mobilizing well. So now the patient start. Yeah. After 2 days, that means after 2 days means now this is special. After 2 days means 2 days ago because 16th, 18th, 20th. So I will say during the first day of our care, if I can use the brackets, that is 16th November. It is good to mention date at time because over here we said on 15th November she was referred to us. So on the first day of our care is clear. So this I use according to whether I have written. I have written over here on 15th November she was referred to us, and during the first day of our care, that means on 16th. So she was found to be moody and lonely, so was referred to local. She was not following her new rep, and for that, she was referred to Meals on Wheels. After 2 days, let's see the improvement. Let's see the improvement. Pain got controlled. Patient started meal and good mode. Yeah, she started Meals on Wheels. She started taking food, and her mood got better or improved. Or and when you will copy this letter 5 times, you will also know the grammar that mood got improved. So these are the simple things you will learn. Copying is not a bad idea if you are learning something nice. Doing yourself and doing it wrong again and again is not a very good idea. So if you copy it, that's fine. You will learn something good. You will learn commas. You will learn connectors. You will learn the flow of the letter. So when you will be writing it a third or fourth time by copying it, you would know everything about commas, everything about you would know about the flow of the letter. So these are the things you learn by copying. So copying is not a bad idea. Even with one video, you can learn everything about OET writing. This is the most complex letter because I have explained you everything. If that would have been a referred patient, I would have written that your referred patient who is better now and is being referred back to you. But in this case, what happened that patient did not go to GP but is a known patient to GP. So I had to use the word known. So that is what is so simple about it. So coming back to this, she started taking food, mood got improved. Today, she is now, it's just about today. She is coping well and is more positive, mobilizing index. Today, she is coping well. Now it's copy paste and is more positive. And what else? And mobilizing independently, well and more positive, as well as mobilizing independently. I've written that much wrong that even Auto correction could not correct it. Okay. So now see, I'm just trying to make it easy. Copy paste independently. Wound is good. There is no sign of infection. She is eating well. Her wound is good and there is no sign of infection. It's just so easy, our copy paste. But the only problem is data selection. So when you will try to look it as a nurse point of view, thinking about making a patient better or delivering a message to GP, then it will become easier. So coming back to the point, eating well needs to be monitored. There is no sign of patient. Along with this, she is eating well too. Eating well, but needs to be monitored. That's it. Sutures. Please note things like this. Please note which are important. Please note sutures are to be removed or need to be removed. Need to be removed. How simple, simple, simple. Sutures need to be removed in week's time. This is what I'm telling the GP now. Week's time. And she needs to be monitored. Monitored for her weight, mental health, weight, mental health, and mood. Or we can say she needs continuous monitoring, because ongoing monitoring, you can say. This is the best word. When something has already been done and it still needs to be done, you say ongoing. She needs ongoing monitoring for her weight, mental health, and mood. This is my complete letter. Now let us check out. This is OET letter this much. This much. That's it. So the letter that looks so complicated from the question pair can be done like this. And now talking about to how to write rest of the things. Suzanne Matthews, GP, Dr. Maria Jones, 128 Blacks Road, Lonsdale's essay. So I will do that. So how to write in OET, final OET exam, Dr. No full stop, no commas, Dr. Maria Jones. So I'm telling you the complete format now. Maria Jones, no commas, nothing. GP, that's her designation. Second line, 128 Blacks Road, comma. This comma is coming because it's in the same line. So 128 Blacks Road. Even if you will not write, it will not change anything. 128. It's not given over there, so I'm not. B should be capital. Blacks Road. R should be capital. The first element should be capital. Blacks Road. Lonsdale. Black spelling. Yeah. Lonsdale. SA 1523. SA 1523. Regarding Mrs. Suzanne Matthews. No full stop, no commas again over here after Mrs. or Doctor. Mrs. Matthews. Matthews spelling I want to know. MATT. Mrs. Matthews. Double T. HEWS. Aged 76. That is how you write it. Then you say, Dear Dr. Jones. And you put the date, 20th. Oh, sorry. Date should be above. Sorry, my fault. Date should be after this. Sorry. Yeah. 20th November. So this is very important to be written. That is why when you write it today over here, that is where they can relate today is 20th November. Only space of one line over here, one line over here, one line over here. This is the complete format. And now, should you require further information, this line is not counted. So the word count is only of this much. This is your word count. That's it. This is your word count. So should you require further information, feel free to contact. Yours. So the name is given of doctor and the patient as the doctor's name is given. So yours sincerely. If the name is not given of doctor, then you say yours faithfully. Yours sincerely. Community nurse. You were the community nurse. Yeah, we were the community nurse. Community nurse. And any name is given of our, any name is given? No, nothing is given. Our name, I hope it's not given on the first page. If it is given, I can use it. No, nothing is given. So I will write it. You are sincerely community nurse. If the name would have been given, I would have written here like BKM. But the name is not given. If the name would have been given, I would have written. So yeah. So the name of doctor is given. So I'm writing here. You are sincerely. Sorry, you are sincerely. Yeah. That's it. Complete letter. Total overall, it took around 45 minutes only. And that too, I was making you understand. I was making you learn. I was talking about commas. I was talking about how to read it. If that would have been my exam, I know the last paragraph, purpose. Then you summarize the first thing during hospitalization. The main and the most important trick and the difficult part of this letter was to how to transition it. That was over. This line was the most special. On 15 November, she was referred to us in condition in which this was the toughest line. That is where the whole smoothness of the letter has come. This is known as the written discourse. What these people say. What is the flow of the letter? So this was the flow. On 15th November, she was referred to us in condition in which she was enjoying. During our first day, she was found to be moody and lonely. So if you can say, if you want to write even however, this will also suit. However, during the first day of our care, she was found to be moody because we were thinking that she was enjoying food, but she was moody and lonely. So she was referred to local sport girl. She was not following. But again, this is a risky word. I will say again, make it easy. If you want to write anything, the only thing I am thinking about adding is 16th November. That is the only thing is that is I'm thinking whether to add or not. But that's the only thing I feel like I should add. But that's again up to us because one thing cannot take your marks away. So that's the only thing I wanted to write. Now the word count, if I say is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, almost 14 words in a line. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, including this. So 16 into 14, if I do the calculator, still, even after omitting so much of data, I would still find Miracle say it still should be higher. It's 224 words. So 220 words is fine. If by chance, if you would have asked me, what thing do you think you could have avoided a food infection? So medications were given. So it saves my 3, 4 more words. Dietitian review was done, or you can say so dietitian helped to increase her diet with more proteins. So again, saving of words. And what I'm doing by saving words is to make it more simple. That is what I'm saying. The simple you will write, the word count will be in your control, the better it is. So now this is your complete letter. And now the word count is all good because I have dropped almost one line. That is 14 words. 210 words are fine. It's good enough. And somehow this does not have, it has only four words. It has only 4 words, 3 words. It has only got like 6 words. So obviously that should be around 200. Now this is like a perfect letter of OET. So this is Dr. Bhupesh from Dr. BKM Institutes. Again telling you, take it easy. Even when it comes to reading, do only easy questions. Do only easy questions. You will pass. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel and watch as many videos as possible to become a pro of OET. Thank you.